I welcome you all to the insightful session. We are happy to have Shivani Garu here present as a part. This session will be held by Dr. JVD Prasad. He is a MPT in Neurology and he has got other affiliations in calligraphy and yoga. He has been working with us in MMRI since past 1 year, and today he'll be talking on epilepsy, how to take care of first aid, and what gets epilepsy during the session or during the assessment.
I request Shivani Madam to say a few words.
I'm talking on behalf of Rotary Club of Lake District. As usual, I thank Sunita ji and my institute for organizing these wonderful sessions which are helpful to all of you. I hope this session today, and epilepsy is one of the major things which we neglect and we don't know how to react on it. My brother had epilepsy. I have 2-3 people in my family who have epilepsy, and I know how difficult it is because at that very particular moment, if you don't react, no, then you can lose your tongue, you can lose, like I have seen situations like this. So I hope this session helps you. Thank you very much, and I hope you all enjoy it.
I welcome Dr. JVD Prasad.
Today we'll discuss about epilepsy, how it's going through, and how we have to deal with this condition, especially in your profession or as a normal human being. Now, before going to discuss about the definitions, types, and different kinds of characteristics, first we have to know about our brain functioning and electrical activity going in our brain. If you see, our brain is a very complex structure. So it is made out of 4 parts: frontal brain, occipital brain, temporal brain, and also homunculus. Now, the complete brain is a full fatty structure which is surrounded with cerebrospinal fluid which connects towards the spinal cord. Okay. Now, the brain is made out of a very fat tissue called sulci and agare, the compressions and the depression catechins. Now, when the neurons connect each other and they send neurotransmitters from one place to another place to achieve one particular function, okay, so that leads our normal life as a ADL activities of daily living. Now, in the case of brain activities, when the neurotransmitter has been sent, there are glutamate neurotransmitter and also GABA neurotransmitter, where the glutamate transmitter is excitatory in state, and also GABA, it will decrease in state. So in the case of epilepsy, when the person want to do something, first the brain has to send the first order neuron where the initiation and thinking all goes in front, and then the execution starts with other flow, and then the body execution starts. So in the brain, we have left side hemisphere and a right side hemisphere. If you see the green color part, okay, the primary motor cortex and the somatosensory motor cortex, the both side, the right side hemisphere is responsible for the left side of the body, left side hemisphere of the brain is responsible for the right side of the body. When, if a person want to speak, if a person want to do any kind of ideal activities, if the person want to reach something, just like if I'm holding this particular thing, it happens in a seconds of a matter. Okay, but our brain has to go with the first order neuron, second order neuron, and third order neuron for the execution of this particular thing. In that particular way, if you see the primary motor cortex, in that cortex, then what particular line has this particular sulci and gare, which are key responsible for this particular organs which are showing in there. This is called little man's brain, where if a person is speaking, then the mouth is responsible for the primary motor cortex, which has a different area numbers, which we called Brodmann lesions. In a general way, if we are speaking, our brain is a complex, just like a building, okay, with 52 different types of rooms and 10 different types of stages, 10 floors with 52 different types of rooms. In that particular way, some rooms have doors, some rooms have directly open ceilings, some rooms have different types of what we call the windows, and some rooms don't have doors and openings at all. Like that, the Brodmann lesions are differentiated. I'm just taking a very legible example. So in that particular Brodmann lesions, if the person electrical impulse, where the neurotransmitters are passing from one area to another area, the one area Brodmann lesions, just take it as a 51, 42, 43. These things are very initiative for the motor activities, execution, speech, and also thinking. Now, if the person want to do one particular activity, these things, these Brodmann lesions are take a key pointing roles to achieve that particular functions as a normal human being. If the person is affected with epilepsy or a motor developmental delay, any kind of neurological disorders, these are the lesions which are going to affect in the first state, where their electrical impulses means every neuron needs some one kind of energy which comes with ATP in the mitochondria, adenosine triphosphate, which rushes towards one neuron to another neuron with a neurotransmitter. Okay, and that particular neurotransmitter exhibits that particular action. In that particular region, if that particular electrical rush is going very impulsive way, then this particular condition called convulsions, seizures, or epilepsy happens. If you see, this is a small description on anatomy and physiology of brain regarding this activity. The heading epilepsy. So this epilepsy, it's a neurological condition, but people do call with the different names called convulsions, fits, seizures, episodes, and also events. So they have different names and also they are differentiated from each other, but they comes under same in one particular category. Now, if we discuss the three parts, the seizures, convulsions, and epilepsy, the three are different, but they comes under same umbrella. Now, if you see the seizures is a sudden uncontrollable surge of electrical activity in the brain, and this electrical storm rushes towards the particular area and temporarily disturbs the ADL activities in the persons. Means they lose the consciousness, and also it affects the person's brain for some matter of time, and they come out of confusion with the jerky movements and some part of legible conditions which affect in neurological way. Now, the seizures can happen to anyone at any stage. Okay, not only in the pediatric versions, neonatal and also adult, and also for the geriatric conditions also the seizures can be happen. The word seizures indicates it happens for the events or in episodes. So the seizures can be occurred in febrile seizures. They can be occurred in a fever, high fever, and also in anxiety, and also in a high angry situations, and also in a rushing situations. The person is not having a motor control, and then they are getting into anxiety, panic attacks. This can also occur the seizure effect. Impulses which are going down, okay, and the waves which are coming up were calculated in the one particular medium scale. Now, if the person is having a partial seizure on this particular limbic system area, if you see there are irregular patterns of the EEG content, that means the brain is reacting internally. If the psychological effect and an emotional status has been stabilized and it has paused, and then it is impacting on the brain regularly, and the person is unable to show the physical movements, but he is pausing in particular time. And generalized seizures, if you see the complete confusion of the brain, which is affecting more than 3 or 4 broadband lesions. The key responsibles are Wernicke's area and what we call ataxic areas. Then execution stops. The person is affected with seizures completely. We do have different types of seizures. The first one is an absence seizures. The person will be the completely silent, mute, and he will be just like a statue, and eyelids will be going, the pupils will be going up, and he will be thinking in a different way, and unconsciousness. Sometimes he will be pausing for the longer period of time, like 60 seconds to 80 seconds. Then he'll come back to the consciousness with some kind of confusion. This is the absence fever. If you see the myoclonic seizures, we do have images. Myoclonic seizures, the second image, the person will be having the head jerky movements, hand jerky movements, and the person can harm his own mandible, the tight mandible, and sometimes he can bite his own tongue. And in this particular area, the person can also go with a hemorrhagic stroke. That is why the seizures is a many characteristic symptom for many other neurological conditions, just like Parkinsonism and muscular dystrophy in kids, and the hemorrhagic stroke, ataxia, and also in some conditions like motor developmental delay, and then also in PDD conditions which are having motor deficits, they can also have this myoclonic seizures. And these are only characteristics which we can see. They are not completely affected with epilepsy. If these episodes are reoccurring in a person in a day-to-day life, then we will conclude it as a epilepsy. We'll see on. So if you see the second one, there are atonic seizures. Now in this atonic seizures, the person, he will be in a walking stage, or the posture will be completely aligned. So in a person, if the person were to stand, knowingly or unknowingly, our parasympathetic nerve systems inside the brain, what it will do, if I'm standing with my own consciousness, that means I'm not barely concentrating on my legs, I'm not barely concentrating on my hips, and it is going accordingly. Parasympathetic nerve system is working directly. But that parasympathetic nerve system, the autonomic nervous system, which is directly continuing in the brain, it will alter and it will stop its main functions, which are the basic needs of a human being. That means if I'm standing normally, that means this is only the normal ideal activity which we do in day-to-day life. But when the person is affected with atonic seizures, the first thing is like the person will lose his base of support and also center of gravity in the spine. So immediately, whatever the weight which is carrying on the body unconsciously with our own body, that will lose. That means the head circumference and the spine and the body, all they will lose in the balance and the person will fall down. So here, the fall preventions injuries and also the head injuries, whiplash injuries, and the person dislocation of a shoulders and elbow occurring. Those things happen regularly in atonic seizures. And these seizures, all these things can be controlled and also managed with different kinds of medications which are available day to day life. If you see in the conversions, the shaking hands and the jerky movements, and that can last up to the seconds to the minutes, and the person may lose his consciousness, drooling, rabbit eye movements, which are going the irregular eyeball movements, and loss of bladder control, and also the person may also experience with the high jerky movements which can harm himself with the repeated fractures. These are the regular signs and symptoms for the all conversions, but these symptoms are not maybe present in the seizures or in epilepsy. These are only the signs which we can see with the different kinds of seizures. So convulsion is one kind of sign for a seizure. Now, seizure is an electrical impulsions which are stopping on one particular area. So the both has a different. If you see the convulsions, the person will be like this. So jerky movements, the person don't have a control on it, but the body is executing that particular thing. Even if the brain has 2 volts of current in the body, which are flowing with the limbic system of cerebrospinal fluid, the person may affect with 8 minutes of convulsion, which may lead to death. And 2 volts of voltage in a brain can be caused with only 8 watermelon seeds, dry seeds, if not 1 dates. So just think, our brain can do has more potentiality than what we are doing in a day-to-day life. This is the one thing which everyone has to be taking care as a note, as all conversions are seizures, but not all seizures are convulsions. Now, every conversion, it may be a jerky movement, irregular eyeball movements, maybe harming to himself, say, if not, he's going into the tremors, he's going into the involent movements, and the person is going into the confusion and he's pausing everything, comes under seizures. But not all seizures comes under convulsions. Sometimes, if the person is going with a muscular dystrophy, if the person is going with a global developmental delay, which are comes under perversive neurodevelopmental disorders, can also have convulsions as a regular basis in a day-to-day life, and that thing can have its signs and symptoms. But for that particular thing, we don't give any kind of a seizures medication. We give medications for the developmental delay. Now, the last one and the main condition which we have to discuss is the epilepsy. Now, epilepsy is a serious and a severe neurological condition which may come due to congenital disorders, and the person can be get this condition through acquired natures, if not any provoked characteristics of that one, another characteristic of the disease, if not in any differential diagnosis also, this condition may happen. So usually they generalize this thing as a local and localized epilepsy or a generalized epilepsy. In this particular epilepsy condition, the person knowingly, unknowingly, the person don't know when these particular attacks are happening, and the triggered points, all these conditions can affect his complete neuronal disease. When the brain stem descends downwards towards the atlas axis joints to the lumbar spine, the complete spinal cord elevates the complete spinal nerves. And 32 pairs of spinal nerves, in some particular points they attach, and we call it as a plexus. In the upper limb, on the cervical region, we call it as a brachial plexus, In the lower limb, we call it as a lumbar plexus and the sural plexus and a sacral plexus. All these plexus have their own key points in the physical activities in the disabilities. If the person is having a motor deficit, if the person is having a low nerve impairments, and also the person is having a low muscle tone atrophy, and all these things may be the another characteristics of this particular epilepsy. If we see in epilepsy in the neurological condition, if the person is getting epilepsy with a series of episodes of seizuring attacks, and if the person is not under the medication, then the complete nerve system, due to the storm of the electrical impulses, maybe his brachial plexus may affect, or one or two neurological palsies may occur. Just like if you can see, all epileptic patients, once in a while in 3 years, the person may affects with cervical spondylitis, Erb's palsy, if not the ulnar nerve deviations. All these conditions can be seen as a clinical manifestations occurred due to convulsions and epilepsy. So these conditions can also alter the person's conditions. So the medication and under the supervision of general medicine practitioner, we have to control this epilepsy. And if the person is having a epilepsy, what we have to do? There are many rules, and diagnosis is very important. Screen test is very important, and differentiating whether it is a congenital, acquired, or a generalized one, or a provoked one. If the person is having epilepsy or a seizures as a neurological condition, they have to intimate, and also they have to go through some schemes so that they can take care of themselves throughout their life. And if you see, why multiple names? Seizures, epilepsy, and convulsions. Convulsions is a sign. Seizures is the episodes of attacks, and if these episodes of seizures is happening, then we call it as a neurological condition called epilepsy. Now, if you see, if we are in any this particular stage, if the person is going through seizures attack, and if you are in that particular stage as a normal human being or as a normal social human being, what we have to do? So, what are the do's? What are the don'ts? We can see the person is affected with epilepsy, and the person is going with a very severe attack, and the person can injure himself, and also all neurological disease has been seen. The person can also see his mouth which is contracting and a mandibular dislocations, and also the person is going with a heavy breathing. And then the other people which are helping him, they are just holding him and they're taking control of this particular time period. So this is one kind of serious way of epilepsy condition which has a neurological effect. Now, how we can say that the person is getting as a medical professional, we have to know some do's and also don'ts. Now, how we can help as a first aid person, not holding himself. There is a serious with the person are holding a keys in the hand and keeping spoons in the fingers. All these things can alter the electrical imbalances in the brain for some period of time. That was a myth, because the seizures attacks may be within a seconds or in a 1.5 minute to 2 minutes. In that particular period, no iron or no neurotransmitter is going to interchange in the brain. So that is why if you are keeping in his spoon or a hand and everything, he can harm himself. So that is why it is not recommended to do that. If you are in that particular situation, we have to give time and we have to make him sit, or we have to make him place him in a supine position. That means in a sleeping position, and we take him into the safe position, not to injure his head, not to injure his hand. Don't hold his hand tightly, don't hold his limbs tightly, and don't force him to stop himself. Give his time, and as a medical profession, try to record these particular episodes for how many seconds, so that immediately after calling the ambulance or going to a doctor, we can say that this particular seizure attack has happened for 30 seconds or a 60 seconds or a 1.5 minute. By the time the doctor can conclude, and his way of investigation in diagnosis will become very easy to give salbutamol or livopril or any kind of injections which can happen. This is one kind of the person is experiencing the absence seizures, where the person is completely statue just like a rock, and after the 30 seconds or 10 seconds, the person will come into consciousness by blinking his eyes, and after the period of the seizures, the person will come out. This is one kind of jerky movements completely involved with physical movements in the body, where this is a frontal bone epilepsy. The first which you people saw as an Indian person was a temporal bone epilepsy. So different modes has a different kinds of clinical features. due because of the facial palsy or a Bell's palsy or some other conditions. This is one kind of clinical features where these seizures are happening. One side of the brain is working, she is listening, but she is undergoing with the seizures. Now, this is not epilepsy. This is a seizures, which is a sign of another condition. These are myoclonic seizures. Over. Only 1 second of a seizure where his eyes are going up and he's biting his own tongue for 1 or 2 seconds. Then. And sometimes the myoclonic seizures, especially in India, because of high copper content in the pots and water, the person may affected with the stiffening of the things which may dislocate. And sometimes the person who is having Ajinomoto salt, sonomodium glutamate, tasting salt, which makes a person bone very brittle, they can also affect with chicken noodles and burger daily, which has a MST. And the person is having a mesomorphic content with the bone stabilizing brittle bones. Excessive Ajinomoto can also increases the uric acid. There are no basic pH level of a uric acid levels may sustain, and also it increases the excitatory levels in the body, and it may affect psychologically, and that psychological effects in anxiety, panic attacks, and all other depression and things can affect the person who go with convulsions or seizures. Sometimes there are also this is a sleep seizures with eye involvement. The person don't know that the person is having this, but with eye opening, with the lip movements, and this is because of right focal movements. So all these things are there, and when we experience has a pediatrics or if any clinical features, then first thing, give them some time to overcome that particular stage, and then keep them away from the sharp objects and very which can harm them, and then turn them into supine position to the side lying position. Okay, and then calculate the time, make a note, and submit to their parents or curators, and specifically write a report on that particular phase. If not, give a feedback to MBBS doctor for his own help. And what are the don'ts? Don't hold them tightly. Don't put anything in the mouth, because a tooth fractures, orthodontist can also can't repair them. And also incisors and scissors, the mandible has almost only 80 lb of a power while mastication process. Especially when they don't have a control, the mandible acts very sharp with the masseter muscle power. They can bite you, and also they can cut your hands and other things. If we are keeping a very strong object in the things, they can bite their own teeth, and the teeth can be dislocated. And sometimes the tongue they come out of. Most of the times, the palate will go into the numb stages in the seizures effect, and they don't know what they're doing. So sometimes they'll open the mouth and they'll do the convulsions effect, and suddenly with the jerky movements they'll close the mandible. Don't feed them or don't give any kind of water when they are in the seizure effect. After that time, give them time when they're coming into the consciousness. Then speak to them. You ask them their name and you ask them their what is his age. Because if the person is completely consciousness, he will ever and he will say the direct answers. Then you can give him, you can feed something, and you can ask him to take some rest, and then you can consult the general medicine practitioner.
She had bilateral severe hearing loss. So we fitted the hearing aid for her. Whenever we gave sound, she used to throw the hearing aid away and vomit. This was like, I thought children now. So when we fit the hearing aid with earmuffs and all, they feel uncomfortable. So then I started the ABT session. So I saw the started the ABT session. So again I started the session, and then I actually started the session. The child was wearing the hearing aid. So when I started the session, when there was a reinforcement, I asked the parents to clap. So immediately after the clap, the child threw away the hearing aids, the child vomited. That is all I saw. 3-4 sessions with the hearing aid, the child was vomiting. So then I went to a doctor, then I went to an ENT neurologist with that child. Then the child was actually diagnosed with something called as audiogenic seizure. In the sense, whenever the child hears the sound, the child is getting seizure. So it was a very, very rare case which I saw, and I don't know why God created the child with hearing loss. Now we got an answer for that. So we could not give hearing aids, no cochlear implants, no amplifications for the child. So we recommended for Indian Sign Language, ISL. Sir, my doubt is, can only vomiting be a symptom, or we missed out some other symptom in my session?
The audiogenic seizures which are happening in that particular baby, maybe because of another key factor also. It's like we have a biggest cranial nerve called vagus nerve inside the brain. In some epilepsy conditions, vagus nerve stimulations through some kinds of surgeries can be controlled in epilepsy. So when the vagus nerve is completely in this our brain, when the cranial nerves are intact, when she is hearing the high syllable sound, which are sharp shooting things, then automatically the vagus nerve and the vestibular nerve gets irritated, where vagus nerve is very responsible for digestion, okay, immune response, and thinking, memory, and also the person's anxiety niche. Now, whatever the clinical features you said, where she has a minus, means this very sensitive vagus nerve. So that is why we can't replace the vagus nerve. So that is what, whatever the functions happen to the particular key functions of the vagus nerve, the same side deficits have become the clinical features in the things. Not only the digestion problem, she can also experience the stool problems. She can also can't go to the seashores. She can also don't, she can't go to the roller coaster. She can't go in a speed bike, and also she may experience as burst sounds in the sleep things. All these things can also a clinical features in audiogenic seizures. In that particular seizures, the person has to go with a very precise futuristic plans, where the person, most of the times in government sectors, ma'am, in the all universities which are under UGC, the most of the librarians, and 10 out of 3 people, they have audiogenic seizures. The librarians, they speak very low with a very low sound, and they try to stay 8 hours of work in the library, so that the medications which they are taking inside the library, there is a pin drop silence, so the medications affect more, and the person can lead a normal life for next 6 hours. Medication वो जेलिसिल के जैसा tablet मिलता है. Okay, they will be placing just like a necklace. Okay, whenever they're having this particular roller, they'll try to chew that particular tablet. Immediately, he will be getting consciousness, but he can't escape the seizures effect. He will get into consciousness, he will go into safe place. So if it is in the home or the, no, ma'am, they are prescribing. Because only for precise conditions they are giving these chewable tablets. For everything, it's like for pediatrics, this is a Livapril. For adult person, it's a salbutamol, and so for some other conditions, they use the Botox and other treatments, which they are not directly using the seizures medication. Because if a normal human being who is affecting with the seizures, in the first 3 episodes, if he is taking 0.5 ml of a medication, on the next episode, if he is getting, he has to take 0.75 ml. He should increase the medication level, and the last medication level he can take is up to only 5 ml. Because now in this summer, no one wants to be eating tummy full of stomach. They want to have a water liquids for a tummy full of thing. But in the next season called rainy season, and after that particular season mein, the person want to have a tummy full of food, and he want to cover himself in a blanket, and he want to sleep in a AC. After having all those things, the excited level of the glutamate, which is a new key neurotransmitter, which is not releasing oxytocin and which is releasing stress hormone, then that is a clear sign of an aura, and the person may affect seizures. All of a sudden, thinking about one person, thinking about one event, thinking about money, thinking about not having money, thinking about one person, thinking about losing of a person can also give a seizures, and episodes of that particular seizures is a neurological condition called epilepsy. For awareness program, we have different dates which already completed in March, but usually in previous last decade, the for epilepsy and a seizure, they used to have a orange color tag. Now they are going for a purple. So especially if you are wearing a purple ribbon and going into the hospital, in especially neurological hospitals, they respect you because you are a key controller of this particular condition and you can help them in a social. So usually the government conducts has a schemes, I'm saying, has a students and also a normal human being. Government conducts a different kinds of schemes and workshops for medical social workers. Any person after the 10th till the PhD level, any person can participate in these things, where they teach you a different kinds of helping manners, not only for this epilepsy, seizures, they can also give you the first aid regions for the heart attack, stroke, any kind of immediate and impulsive emergency conditions which are happening in the neurology. You can have a deal and you can help them. And each and every doctor, even a surgeon, respects the medical social worker, and that the key points of these things. And that medical social workers is one of the author called David Werner. He wrote a village rehabilitation book, and all this matter and all these references has been taken in that things. Thank you.